what fathers should now start playing is in the postpartum health of a woman, where you know about postpartum depression, right? A lot of women suffer from postpartum depression, baby blues. The main problems that women face in pregnancy is right now they are not aware about how childbirth happens. Okay, so the C-section rate has gone up to quite a lot extent in India compared to the other countries. When you do your own practice, sky is the limit. You can earn 1 lakh, you can earn 2 lakhs, you can earn 5 lakhs. Jitna bhi kaam you do, you will earn. Okay.
Hello everyone, today we have Disha Nayak ma'am with us.
Hello.
Ma'am, would you like to give us a short intro to all the viewers about yourself?
Hello everyone, my name is Dr. Disha Nayak. I've been working in women's health since past 5-6 years. I've worked in a lot of hospitals and also worked as an assistant professor in one of the colleges in Mumbai, and currently I'm running my digital clinic which specializes in prenatal and postnatal health. So basically digital clinic is an online platform. It works on tele-rehab. So after pandemic a lot of things shifted to online, and that's where the idea of digital clinic started, and I started a digital clinic with the name of Health and Her. Right, so it basically focuses on women's health. The journey from adolescence to menopause is very different, for every lady it's very different, every phase is very different, and every woman requires a lot of support, emotional support, physical support, and my mission is to give that support and create that kind of environment for women to to help them live their best life physically and mentally.
Ma'am, how did you come up with the name? Because deciding the name is also equally hard, which people don't know usually.
Right, I know. When I started with the online, so first I started with online classes for pregnancy. So I was thinking what to keep, what name to keep, which will basically take everything. It will show that it is for women and it is related to health of women. So Health and Her, that's how it came, and that's how this logo also came, with a woman having wings, as she is healthy, she is physically, mentally fit, and she's ready to fly with good health and with her baby.
Whenever a pregnancy or anything related to women is concerned, people usually think of a gynaec. They don't think of a physio. That physio could also help in this condition.
Right.
What are your views on that?
So basically, a physio's role and a gynaec role is like it goes hand in hand. It is like how a father's and a mother's role is for a baby, right? So what gynaecs do, we don't do, and what we do, gynaecs don't do. So gynaecs. When I come to our role in pregnancy, in postpartum, we deal with a lot of things that are overlooked. For example, pelvic health. Nobody cares about what happens to pelvic floor, but it is a very important aspect in pregnancy, post pregnancy. A lot of women don't even talk about it. They have urinary incontinence and they think it's okay कि ठीक है अभी pregnancy हो गई है, they have delivered, so it's a common thing. But that's where our role comes, when these small things are not taken care of. So that's where physios play a good role in this. And plus, since we have that medical knowledge, we have the knowledge of exercise, we can gather those information, create our own protocol for women. We can help them be their best health in pregnancy and postpartum. We can there are a lot of things that goes wrong. For example, if a woman doesn't exercise enough or doesn't work on core enough in her pregnancy, now that will not be taken care by a gynaec. The gynaec will only suggest her to do exercises, to be active. But that's where physio's role comes. We can tell them how important exercising for your core is, what exercises to do, for the pelvic floor, and that's how her postpartum journey can also become easier with that, right? Because if her core becomes weak, she can develop diastasis recti post pregnancy. If her pelvic floor becomes weak, it's not strong enough and she doesn't get back to it, she can have urinary continence for a really long time, which can become worse in her old age. Also, one important thing is bone health. Okay, so the baby takes a lot of calcium for mother, so that's where strengthening exercises help. So all these small aspect is where a physio plays role.
Ma'am, how do you think like a physio? If a lady is pregnant and comes to you, how do you approach the particular condition?
So basically, I focus on general pregnancy exercises, but each ladies and each woman's needs are different. Okay, like for example, if a woman one comes to me, she might be a lawyer and she might be like standing the whole day. So for her, the protocol will be different. For her, the exercises will be different. Then if someone comes to us with a IT job, or then for her concerns will be different. So that's where a physio is important to determine what exercises work best with that.
Can you a little bit elaborate more about the exercise, please?
So basically, with physio exercises, I've also done courses in yoga, in Pilates, and all that. So I use those techniques to develop protocol. It can be for a group class where we do general pregnancy exercises for all. That includes stretching exercises. Now, stretching exercises help because as the tummy grows, the round ligament also stretches. So you need to do those stretching exercise to accommodate that growing belly. And because of hormonal changes, there is also changes in the ligaments. They become lax. The back ache is very common, especially in pregnancy. In the second trimester, backache is super common. So that's where we play a role. Then also Pilates helps in core strengthening. So I combine basically physiotherapy exercises like isometric back exercises with a little bit of Pilates movement and create protocols for that.
Ma'am, you have taught people all over the world, I would say, not just in India.
Yeah, that's
so
right.
how would you say that Indian women, all their concerns are different from those of people abroad?
The women in abroad, there are the policies for women's health are quite better in abroad. Some of the countries, now it's again different in Europe, it's different in US. So the childcare policies are different, so that's where they have a benefit. But in India, the women have support of family. That's what the women in foreign countries lack. So it's different, the concerns are different. And of course here we have a lot of house help, we have family help, so that all is lacking in foreign countries. Again, some of the European countries have really nice pregnancy policies, like they give 6 months maternity leave to the mother, 6 months paternity leave to the father. They can combine it, make it a year. They give 1 month of maternity leave before the delivery date. In US, in some of the companies, they have like 3 months of maternity leave, compared to which in India it's better because most of the companies and most of the employers give at least 6 months. So yes, that way the concerns and the lifestyle differs.
And how important is paternal role in pregnancy also, because it is something which is underlooked back then, but now it is improving.
Yes, definitely. So if you see my Instagram page,
Yes.
you will see a lot of reels on how important a father's role is, because when a woman gets pregnant, father will obviously, most of the fathers will take care of the mother, of the nutrition, especially nowadays. But it is also important for the father to start bonding with the baby right when she is pregnant, not after it, like by talking to the baby, by playing songs, by helping the mother with some massage, caressing the bum, something like that. But the major role what I feel a father should play is in the postpartum period, when the attention shifts to the baby and the mother's health is kind of ignored. So I think important role what fathers should now start playing is in the postpartum health of a woman, where about postpartum depression, right? A lot of women suffer from postpartum depression, baby blues, and general anxiety. So that's where when a father contributes in taking care of the baby, giving the mental support, do like kind of being okay with mother's mood swings, and taking care of her emotionally, that's where a father plays important role in.
Ma'am, for someone who's aspiring to be a women's health physiotherapist, what are the courses that you would recommend, and some institutes offering that course?
So basically, after BPT, you can either go for MPT in obst and gynecology. Otherwise, there are a lot of institutes like Kappa, Lamas. You can do Ayush yoga classes to get certified as a prenatal, postnatal yoga therapist. Then there are a lot of Pilates, aerobics, and prenatal courses by IAFT also, which I have done. I've done almost all of this. Then garbhasanskar courses. So basically you have to do these courses, but your practice is what is going to teach you the most. Okay, learning from the patients is going to teach you the most.
And ma'am, how did you decide to do in practice in women's health?
So from my MPT days, in fact from my BPT days only, I have been interested in women's health, because I feel women is like a backbone of the family. If a woman is healthy, and for longest time women's health has been ignored to great extent in the daily chores, taking care of the family. Now the women are working, so in the work family balance, they tend to ignore their health. So I feel there was a great lag in women's health, especially in physiotherapy section. You will see a lot of sports physiotherapists, neurophysiotherapists, orthophysiotherapist, but women's health is something what people are not aware about. But yeah, right, currently due to Instagram and due to a lot of awareness, people are aware that there is something like women's health physiotherapy, Gynaec physiotherapy as well, where a physio can also help you in that phase of your life.
And ma'am, you have also been a part of teaching, and you're also now doing online. So which is better according to you?
I'm doing my online, but now I'm teaching the mothers. I'm teaching them how to birth. I'm teaching them how to do breathing, lamas. I'm teaching them childbirth education. I'm teaching them exercises. So I think it's similar, but now I've shifted the teaching to mothers from students.
What are the main problems that women in India face, and what is the cause for those problems?
And which they are unaware about.
So basically, main problems that women face in pregnancy is right now they are not aware about how childbirth happens. Okay, so the C-section rate has gone up to quite a lot extent in India compared to the other countries. So they need to be aware about facts, why C-section happens, how to avoid it, how to go for normal delivery, and of course with the guidance of the doctor. But they also need to be aware about scientific facts. So that's where childbirth education plays an important role. Second thing is they were not aware about pelvic floor, like what is pelvic floor, how it helps, how pregnancy affects the pelvic floor, and what conditions can develop. So again, now slowly mothers have started becoming aware. They come to me and they want to know about pelvic floor exercises. They want to do it in the pregnancy, they want to continue it in the postpartum also. And a second thing is maintaining a work-life balance. So a lot of time due to work, they're not able to take out time to exercise or invest time in prenatal yoga. So these are some small challenges that women face in India, but I think it's getting a lot more better, and nowadays women are concentrating more on their health.
Ma'am, what is the most common condition that Indian women face during their pregnancy or postpartum?
So I would say it's pelvic floor dysfunction. That is the most common thing that women face. Second would be diastasis recti, and then of course the common backache, postural backache, then upper back, mid back pain during breastfeeding. So that's what is common and most.
And what are the three things which you came to know after coming in clinical practice which you didn't know as a student?
A lot of things, I would say. Most of the things I did not know when I was a student. Even I did not know even when I was doing MPT. So basically I didn't know much about pelvic floor, though we learn a lot of things about pelvic floor, but practical problems is what I learned in my practice. Then how to interact with actual patients, we do it in our clinics, but when we interact with, now these mothers are not patients, they are like mothers, it's not a condition, right? So how to interact with mothers, that is something I learned in my practice. And how to use the exercises that we learn in BPT, we learn in MPT, how to make a protocol out of it. We give exams, we give practical exams, but practice is actual practice, actual clinical practice is only going to teach you.
And how much can you earn in a month approximately if someone wants to get into women's?
Okay, so see, basically you can earn up to 1 lakh to 1.50 lakhs in a month, and more than that also. But you know how it is for physios these days. So basically I would say, rather than working in a hospital or something, you need to develop your own skills, because what you earn, how much you earn, depends on your own skills and your personality. That is the only way a physio can earn well, not by joining any hospital or working in shifts or doing home visits. Your own skills, people are ready to pay, people will pay. If you're good, people will pay, you will get patients. But you need to be really good with your knowledge, you need to be really good with your practice, you have to be true to yourself. You don't need to cheat a patient, keep bus, or be lazy about it कि ठीक है आज इतना करवा दिया कल उतना करवा दिया, वैसे नहीं. You have to really be in it, you have to really make it a goal of your life कि I am in this field. Like for example, if someone is into pediatrics, the goal of, you have to not look at it as just a profession or just like you taking out some hours of your day to treat that patient. You really have to think, eat, sleep about it and make it the main goal of your life, and you can definitely earn really well in physio as well, be it women's health, be it sports.
Just having the right intention कि I want to get that patient better, not just for the sake of treating and for the money.
Yes, for treating, how to get it right, like you have to have the best interest of that patient. Basically the money will definitely follow.
Ma'am, what do you think, whose mindset is better? Like Indian women, they are more, like we say that Indian women are more like mentally better compared to the other women around the world. So is that true when it comes to pregnancy and
So from my experience, I would say no, it doesn't work like that. Because women from foreign countries, they are quite self-sufficient, be it household work, be it taking care, they do everything from the scratch. So and in India there are like variety of women from different backgrounds, so it depends on who's there and from what background she comes from.
And ma'am, how important is to create a personal brand and making an Insta page or anything, because somewhere the personal brand also plays an important role.
Yes, definitely. So that's what I was telling you. Creating your personal brand is the most important thing for each and every physio. Like you can work in a hospital, you can work for 10 years, you can work for 15 years, but till you build, even if you're working in a hospital and not working in your own clinic, or you haven't started your own clinic, but building your personal skill set, you should be so special that no one can replace you. Then only you can excel in this field.
And now, according to you, which is better, working in a hospital or doing your practice by your own?
So for me, working in a hospital doesn't work well. I do not like working in a hospital or a clinic. I prefer doing my own practice. I prefer interacting with patients on one-on-one basis, knowing what their concerns are and managing my own thing. But for someone who may not have those kind of skills, a hospital can also be fine. It depends on what kind of a person you are, but for me specifically, I would say I prefer doing my own independent practice and not working under someone else.
And ma'am, what is the salary which you can expect in a hospital versus doing your own practice?
So when you do your own practice, sky is the limit. You can earn 1 lakh, you can earn 2 lakhs, you can earn 5 lakhs. Jitna bhi kaam you do, you will earn. Okay, and in a hospital, I would say something between 50 to 60k maybe, or maybe less. It depends from hospital to hospital, and depends on what your experience and what your educational qualifications are.
And ma'am, in your clinical practice, if you have had any eye-opening moment, okay, this was something which is important, which I didn't know back then, but I realized now.
The eye-opening moment was starting my Insta page, which so basically, working under someone or working for an institution was very different. So when I left all of it and I decided to do something on my own, I first decided to start my Insta page and create awareness about the topic I am good at. That was women's health. I did more courses on it, and then I started creating content on it, though I'm not that regular these days, but I do keep posting some videos, and through which I started getting followers. A lot of women started coming to me with their concerns. They started coming to me for prenatal postnatal classes. Now when they liked it, they referred other patients, and that's how it grew. So basically, I think you need to, the eye opening moment will be, you need to do it. You need to, wear your cape and get into the field, and decide, this is not what I'm going to do from today, then this is what I'm going to do from today, and make it happen. You have to hustle a bit, you have to work hard. There are days when I start my day at 7 o'clock and then end the day at 10 o'clock. But if you're enjoying the work, the long work hours don't matter. If you're working in a hospital, you will have a Sunday shift, and you may not like it. Some people like it, some may don't. So you need to have that satisfaction of work. So find your own niche. If you're into sports, find the courses, find the college that supports your course. If you're into pediatrics, you find that. On Instagram also, I see a lot of pediatric physiotherapists who create content related to child development, physical development, growth, and everything. Okay, so they are also doing well. So basically, you need to build your own brand. Whether you're starting your own practice or whether you're like working in a hospital, you have to have your own brand. That is like my eye-opening moment of the entire physiotherapy journey.
Ma'am, for someone who wants to be a women's health physiotherapist, what are the most important aspects or the most important areas in which they have to work?
And also some books if you could recommend.
So there are a lot of books that the normal physio books that you have for women's health, but that don't you can get knowledge from them. But the areas and the courses that someone who's interested in women's health physio should do is, first is she needs to learn about childbirth. Okay, childbirth education. She needs to learn about yoga, because yoga plays a very important role in pregnancy. Okay, so she needs to learn about yoga. She needs to learn about garbhasanskar, about meditation, because those all techniques also help so these are not part of physiotherapy as such, but these are like allied courses which she can do to build herself better. Okay, and she needs to be a little compassionate and passionate about women in general, because women's health does not only mean pregnancy and postpartum. It also includes exercise and nutrition for PCOS, PCOD, irregular periods, and these common conditions that a young girl can have.
Ma'am, the last question. 3 pieces of advice you would like to give to physiotherapy students who are in college right now.
So first advice is like, find your niche, find what you are interested in, and it should not be something very broad. Like if you have done MPD in cardio, you cannot start practicing in ortho. Okay, you decide what you like. If you're in BPD, start exploring different fields, start exploring sports, ortho, neuro, whatever you like. stick to that niche. Like for example, I was interested in women's health, and that's what I continued from starting. I worked in different hospital, but I was like, okay, I wanted to do women's health, तो मैं अभी इसमें ही रहूँगी, and I'll do courses to support it. Okay. Second thing is work on your skill sets, work on yourself, and work on your patient connection. You need to build that patient connection rather than pleasing your boss, pleasing your teacher, or pleasing your hospital seniors or whatever. Work on direct patient relationship. And the third advice I would give is like, don't complain कि ये field में ऐसा है, ये field में वैसा है. Work on it. Those who work hard, they get the results.